Okay, I think we can begin now. I see people are still joining, but we can start, and I'm sure more people will join in. So let me first welcome everybody, our incoming class. My name is Farhat Haq, and I am the new provost who will be joining you. So this class is very special for me because just like you're just joining LUMS, I'm also new and joining LUMS, and I'm really looking forward to meeting all of you. I hope that happens soon, but as you know, the very reason for this particular session is that we are going through extraordinary times right now. The whole world is going through very extraordinary times. And so we have to be concerned about health and safety because of COVID-19. And in fact, LUMS have been focused on that for many months now. And we have been working on plans, and as you know, we will have our fall semester online because of COVID-19. And I know that you have many questions about it. We already have some of the questions from you. So let me first introduce our panelists. They will make brief statements, and then we will answer some of the questions that you have already submitted. And then you're also welcome to submit through this webinar format your questions that you still want answered. And so we hope we have about 55 or an hour or so. So we hope that this session will be informative, helpful in getting you to be becoming prepared. That's what O-Week is all about: orientation, becoming prepared to take on this exciting and challenging task of becoming a student at LUMS. And so let me introduce our panelists. So first, Professor Ali Khan, who is the Dean of Burmani School of Humanities and Social Sciences. And he's also the chair of LUMS Health and Safety Committee that has been working for the last several months to figure out how can we open the campus safely, or what are the best practices that we can adopt. And so he's here to answer your questions. And then I'm also very, very happy to introduce to Dr. Samia Altaf, who's just joined us a little while ago, particularly for this challenging time. She is the professor of practice in public health and director of campus health and safety at LUMS. She is an internationally recognized public health physician who's certified by the American Board of Public Health and Preventive Medicine. She is a graduate of Fatma Jinnah Medical College and University, and she attended University of California at Berkeley. Anyway, we have really a top-notch specialist who is now our director of campus health and safety, and she has been working diligently with Professor Ali Khan and many, many others on campus to develop a plan that ensures safety of all of our community, the students, staff, faculty. Let me then turn it over to first Dr. Ali Khan. He will introduce, well, I've introduced him, so he doesn't need to introduce himself again, but he can make a brief statement, and then Dr. Samia Altaf, and then we'll turn to your questions. Over to you, Ali.
Thank you, Farhat. Thank you very much, and an extremely warm welcome from myself and my school to all of you who are joining us this first day of O-Week. And I think there are lots of things that are going to be covered, and I think nothing more important than of course, health and safety at LUMS. I'm just going to say a few quick things to let you know, what is the thinking behind LUMS' strategy, and then I'll pass over to Dr. Samia, who'll speak more specifically. So as Farhat said, we've had a health and safety committee for some months now, since June. And recently, Dr. Samia has come across has joined us as the Director of Health and Safety at LUMS. Our committee has also got other people who have had medical backgrounds, some of whom have been involved in the strategy for the smart lockdowns in Punjab as well. So we've been guided throughout by really the medical input that has come from these individuals. You will all be aware that in the last month, Pakistan has seen a really quite unique and unprecedented reduction in cases. And I think that's very, very positive news. And I think that's one of the reasons why people feel more and more that, oh, well, everything should be opening up. But I think that positive news needs to be taken with a broader view of what is happening in COVID-19 and framed really by our overall understanding of this disease that we are still learning about as time goes on. So amongst the things that we do know about the virus is that it is likely to remain amongst the population for at least the next year or so. We also know that the virus starts to spread very rapidly when human beings cluster together, as is shown by the recent resurgence of infections in places where the virus had almost dropped to very low levels. In some places, we had 0 cases taking place. So very low infection rates. And then all of a sudden, with one small, start again, we've had considerable outbreaks in countries that are as diverse as Korea, Japan, Israel, New Zealand, Greece, France, Spain. And of course, if you think about it, Iran is still going through a wave. And on the other side of us, on our east side, India is setting new records on a daily basis. And that is something that we need to be aware of. I think let us also keep in mind that the nature of a university, a large young population, people living in hostels, opportunities for congregation, really means that universities are possible hotspots for the restart of an infection. And you will know that because in many US universities, for example, where people have begun to go back to university, there have been quite significant and serious outbreaks, and those universities have had to shut down again. So the next few months is going to be very crucial for LUMS and for Pakistan. We'll get an idea of whether Pakistan is over the worst or whether this is a temporary phase where we are being maybe lulled into a sense of complacency. And I think the government has made very clear, and it has made very clear to universities also, that we need to be cautious going forward. We need to follow SOPs going forward, because otherwise we may well see a reemergence of COVID-19. I think alongside this, LUMS recognizes that we have to find a way to keep our community safe while fulfilling our role as an academic institution. I'll also reiterate that it is in no one's interest that LUMS or other universities stay closed. Everyone wants the university to be open. I want the university to be open. It's much more difficult to do all of this online. Students want the university to be open. So it's really not in anyone's interest that the university stays closed. But reopening campus also imposes risks that go beyond students and faculty who teach them to the many university employees who will come into daily close contact with these groups. So one of the biggest challenges COVID poses is how to ensure that the 90% of the population, which is going to be having at best, at worst, very mild symptoms and is at far less risk, how do that 90% protect the 10% that are at much more significant risk? So as a young and healthy person, a student may not recognize the risk that is present to them, but you are a risk to other people around you. And I think that's really lies at the heart of this illness. You may not be at risk yourself, but you are putting other people at risk because of your actions. So minimizing risks is something that is incumbent on LUMS. It's not simply that students can come back, sign a waiver, and that's it. There are other people who are involved in this situation. So as Dr. Farhat has said, classes will remain online for fall, and we are looking at a gradual opening of the university. If students, faculty, and staff, the wider community are able to follow SOPs that we are working and putting in place, existing systems are able to cope, and we are able to minimize the risk of an uncontrolled outbreak, then the university is in a much better position to build on that success. And you can begin to look at, taking on more students on a rolling basis. But if we go for a rushed or less thought out strategy, the risks of an outbreak are much, much higher, and the possibility of much longer lockdowns is definitely much greater as well. So throughout, I think LUMS has been guided by the reasoning that I've put forward. We remain committed to the health and safety of the community. And I think this is what will be our primary concern going forward, ensuring the health and safety of everyone that is going to be on campus. And we'll be very happy to take questions. I know some of them are coming up and we'll answer them, but I'll hand over to Dr. Samia, who can maybe talk a little bit about the specifics. Thank you.
Thank you very much, Ali, and welcome to the new class. It's a very exciting time for you, and a lot of new things are happening around you. So let me just say first that there are many concerns and questions about how did LUMS come up with this. As Dr. Ali has said and Dr. Farhat, that LUMS has brought a lot of thinking to this issue, with the objective that the university should be open to students. It should be a safe place where they can be productive and learn and grow and thrive, and it should stay open so that we don't go back and forth in closing and opening universities. So this strategy is based on information that we have about the virus. The information that we have about the virus is the following. It is common knowledge that this virus is here to stay. It's not going to go away very quickly. Number two, this virus is also very sneaky and very infective, because it generates what we call super spreaders. People who are very, very infective and can infect very large groups very quickly. And that it propagates very quickly when people congregate together in large groups. So that is a university. So and of course, the treatment and the medicines are not available. So the only option available to us, if we want to go forward with normal life and read and study, is that we have to learn to protect ourselves, and we have to learn to protect and help each other. So this is a new virus. It's acting in ways that are not known. So we have to do new things. We cannot continue to function as we did before. We have to do new things. So here are the new things that we are trying to do. That LUMS is, in its effort to open the university, is building protective systems so that its population can be protective. So when you bring new things and you institute new systems, you have to be learned to able to manage them well and to solidify them and to make them operate in a way that brings good results. So you do it on a small scale. You don't build a huge battleship all at once. You start small. So that is what LUMS is doing. I personally think I've had experience of almost 30 years of doing this around the world, managing and building large public health programs. And my experience has been that you need to start small and continue to solidify that effort and to build on that. I hear students, I've been going on campus over the past 2 weeks, and I meet students and people, and students are telling me, and they use this number. They say, well, CDCs and WHO and international organizations are saying that infectivity is only 5% and hospital capacity is 75%. So the universities can open. Interpreting this data, CDCs and WHO are very good organizations. Their job is to give general guidelines. But these are guidelines, but what happens within a country, how these guidelines are interpreted and how they are implemented depends upon the infrastructure and the working and the population of that country. For example, infectivity in Pakistan and in anywhere else is very much a function of the number of tests that are conducted. It's a function of the number of the contacts that are followed. So in Pakistan, you know, that is not an ideal situation. Number two, the capacity of hospitals also depends upon people's perceptions of how the hospitals are going to treat them, how they will be treated when they go there, what will happen to them when they, you know, their loved ones die. So these data is not standardized, and it needs to be interpreted with a lot of caution and with a lot of background knowledge about your own population. You know, one of the students said to me that, you know, students will all comply, we will all, and he didn't have a mask on when he was telling me this. He said, it was very sweet. He said, we will all comply and everybody will comply. And then what's the problem? You know, in large public health programs, when you set up new systems and you institute new behaviors, compliance is never 100%. Not even the best of circumstances is 100%. And I am assuming that in our student population, it will be, even if it is 50%, I would think that we have been very successful. I urge you to keep that number in mind, because I am basing this on my experience of students in Pakistani universities. And you are all familiar with there. You know, there are SOPs and there are honor codes for students in generally in universities to behave in such a fashion, not to cheat and not to do this. Do they follow those SOPs? Honor code bhi hoti hai. There's also an honor code. So, you know, this expectation that foreign pehle din se 100% compliance ho jayegi is unrealistic. Yes, that is what should be our aim, that we will bring about 100% compliance. We will make mistakes, but we will overcome those mistakes. We will help each other. And the onus is on us. You know, if we are disciplined enough and we can show that LUMS is willing, LUMS is happy to set up systems. They have, you know, given me a lot of authority to decide what needs to be done, where it needs to be done, how it needs to be done. But any plan is only as good as how well it is utilized and implemented. And it depends upon us, on you, the students, on us, the faculty, on us, all of us who are campus community, that how disciplined we are within our own selves as a person, how much responsibility we take for ourselves, and how much conscious we are of the fact that we live in a community where our action has an impact on other person's well-being and life. I will take just one more minute and then I will stop and say this to you, that you know, the doing of things, dismantling things and having them fall apart is very easy. It is putting these structures together and building structures that is the difficult part. But I will also urge you students to look at this tremendous opportunity that you have. I mean, you will be able to tell your grandchildren and great-grandchildren about this, that, you know, when, you know, new systems were being instituted to protect us from this virus, I was there. I helped in this. I helped bring about these new things that are happening. Because see, 20 years ago, air travel changed after 9/11, and now the security systems that all airports follow have become part of our lives. And we talk about it and we say, pehle aise hota tha, it used to be like this, and now it is like this. So look upon this as an opportunity. Ask questions. We are available on campus. I will make myself available as much as possible to answer your questions. And we need to reinforce this behavior in ourselves and in each other. And if we make a mistake, we will all make mistakes somewhere. We will all stumble. Our systems some things will fall through the crack. So at that time, rather than blaming each other and saying, see, we told you this wasn't going to happen, we need to come together. We need to come together as a community and help each other. So I will stop here. I've taken, you know, 5 minutes of your time, and we are happy to answer questions that you have. Thank you.
Okay, so I had to unmute myself. Thank you very much, Dr. Samia and Dr. Ali, for starting us on a very solid footing to address this very important issue. There are already many, many questions that participants are asking. So let me turn to the first question. And Dr. Samia, you will be the best person to answer this. And a couple of people have asked about herd immunity. Do you think that we can achieve herd immunity, or is it just a hoax?
Herd immunity, as you well know, is now being called population immunity, which basically means that a certain proportion of the population somehow gets protected so that the invading agent, the virus or the bacteria, cannot infect them and make them sick. The number of population, the percentage of population that needs to come to that level where the non-immunized or non-protected can also be safe depends very much on the nature of the virus or the bacterium. For example, some viruses, for example, the measles virus needs a larger amount of 90% of the population to be protected to keep safe the 10% who do not have any immunity. So for this virus, you know, there is a range that people are saying needs to be, which ranges from anywhere from 30% to 50% of the population. So that is how much you need. Are we able to get to that? The other thing that we need to keep in mind is that the only way now that this infection will stop is if communities, not necessarily national level, but if communities attain herd immunity or they are protected by a vaccine. The vaccine, let's just set aside the issue of discussion of the vaccine now. So are we going towards herd immunity? My hunch is, and I am only speculating from looking at what has been happening in Pakistan, is that, and to me it seems that is one of the explanations for the low numbers of infection that we are getting right now from urban areas, is that, remember way back in March and in April, there was a lockdown, which was really not a lockdown. People were still going around. You still see people in shops, who are roaming around and with not wearing masks and talking to each other. So that in some sense, the population exposed itself to the virus. And people are now started saying that it's quite possible that some populations have certain cross immunity. For example, people like developing countries who live in an environment which is not environmentally, it's not a very sterile environment. They're exposed to all kinds of viruses and all kinds of junk that is in the environment. So it's quite possible that they have some kind of immunity that we call cross immunity, that it also protects them. These are all speculations. Research still needs to be done on that. So it's quite possible that has happened in some communities in Pakistan. Let me give you an example of a forest fire. If there's a forest fire, what happens is that the vulnerable and the dried up trees around that one fire die very quickly. And young trees that are far away, the fire takes a little while to get to them. That does not mean necessarily that they are protected and they are immune. So that is the situation in our communities. There are some communities that to me seems have developed a herd immunity. So they have protected themselves, but there are still communities where the virus will now, my hunch is that it will slowly travel and will infect people. So even if we are going to say use herd immunity as a therapeutic process, there are still vulnerable people in our communities. We need to protect them. We cannot let this virus run uncontrolled and rampant through communities. We have to protect people. We have to have systems of protection for people and for ourselves so that we can even control the spread of virus. Which is why LUMS is very clear that if there is an outbreak on campus, we need to be able to manage it. We can't just say, oh, the outbreak ho gaya. So that is where I will stop with herd immunity and not take much more time.
Okay, thank you very much. Yes, I've been coughing. One of the students have asked if I'm okay because I'm coughing. Yes, it's just dry throat. Hopefully not COVID. So, but thanks for that moment of levity. So several set of questions are asking about what are the specifics of the safety measures that we will be implementing. And I'll let, again, Dr. Samia address that, but I also want to tell you that we are working on that document, and soon it will also be on our website. So you will have access to that document in terms of what are the safety procedures that we're implementing. But perhaps Dr. Samia can give you a brief overview.
I will give you a very brief overview, and I will invite Dr. Ali Khan to talk about the specifics, because he knows the campus much better than I do. The general safety measures are the standard of epidemic control of any disease applied anywhere, which is that you have to protect yourself physically from being infected. So to protect yourself physically from being infected, you need to wear masks. You need to conduct yourself with distance from the other person, and you need to practice personal hygiene, which is hand washing and keeping your own personal space clean so that you don't let the virus sit anywhere. So that is literally the mainstay of this. The other thing is to share information, so that, if you have information about yourself that you possibly went into a place which was infected, or you did something which was, exposed you to infection, not to hide that information. The system is set up to help you. The system is set up to prevent any deterioration in your health. So those are the general systems. There are specific standards, operating procedures, SOPs, and protective measures that the university is going to institute related to all your activities and actions that you undertake on campus. You go to the library, you go to the gym, you meet each other, you want to sit and study together, you want to eat. All of those actions, we have SOPs. And God forbid, in case there is a problem that, there is a suspected infection, or there's suspected exposure, or there is, danger of exposure, we have set in place systems to cater to that also. The details of that, as Dr. Farhat says, will get to you in writing. I will stop here, and I will invite Dr. Ali Khan to add to that a little bit, so that students are reassured about the specifics on campus.
Well, I mean, the only thing I'll add is that the SOPs are being made for various different parts of the campus. They're quite comprehensive. I mean, they revolve around these three major things that Dr. Samia has talked about: hand washing, wearing masks, and social distancing. And while, it seems like a very simple thing to do, she's also mentioned that actually the implementation is going to be what is going to be the most important thing. We have to ensure that people follow these rules. And so far, what one has seen around Pakistan, and reports from campus also, suggests that not many people are at the moment following it. So we're going to have to reinforce this again and again to ensure that the campus does remain as safe as possible. There are SOPs for computer labs. There'll be SOPs for other labs. There'll be an SOP for the gyms. There'll be SOP for the canteens. So every area of the campus will have SOPs that will need to be followed really quite specifically. On top of that, I think we're going to have some sort of monitors to try and help people, keep guiding people on the etiquette that is required for this.
Okay, thank you very much, Dr. Samia and Dr. Ali. So there are a whole host of questions that are really about the issue of learning online. There are students who are worried about connectivity issues. There are students who wonder if their participation grade. CP would be impacted if they are not able to participate actively for reasons beyond their control. So all of those questions are, of course, very understandable. And I just want to let you know that along with Health and Safety Committee, we had also composed a committee on teaching and learning online, and that committee had been working for many months now and had given a set of recommendations that we have been implementing. Just to tell you that we are very eager to learn from our experience starting from March when we went online, and then this summer we had really a very strong online summer courses, and we have learned from those evaluations. And what the lessons that we have learned, we're trying to sort of implement them. And I see that in your schedule later on, you're going to actually have a session on that. And we see Arshad Saab would actually be part of that, and there are other people. So some of these questions will be answered on that. All I can say to you at this point is that we are highly sensitive to all the issues around learning online, and that we are very much planning to show as much flexibility as we can to make sure that students are not being negatively impacted for circumstances that are beyond their control. But more specifics of that, I think you'll get later on. Okay. So another set of questions I think really keep coming back to this idea that I think people are sort of wondering how long would it continue? They want to see some ray of hope. So is it something that, when would safe be safe enough is kind of what they're asking. And again, I can say simply, because I've been part of these discussions, that our whole strategy is not to just, as I think Dr. Ali Khan had earlier mentioned, it's really not in our interest to keep the campus closed and keep everybody in this highly anxious state. But at the same time, it is so important that we do keep safety as much as our main goal as possible, because after all, no learning is worth your life. And that's, again, there are, cases we're seeing in other places where opening of colleges and universities have in fact then led to those clusters of cases that Dr. Samia was talking about. But nonetheless, our plan is to gradually open up as things, and that's why it is so important. That's why we have this whole session. It's so important that we do indeed do our best to follow those protocols so that we can safely open. But would Ali, you want to say something, or Dr. Samia, would you like to say something about how long would it go on? I think the idea is that maybe we're asking for too much safety, that there has to be some balance between safety and risk.
Yes, Ali, you want to go ahead? Go ahead.
No, please go ahead.
Okay. Yes, I think that's a very good question, and I think it's a question that should be on everybody's mind. I would say this, that what we can only do is that speculate and work forward based on our assumptions. My assumptions right now are, and I feel very strongly, that to a large extent, the continuous opening of the campus depends upon us, the campus community. So if we are disciplined enough and we follow the SOPs, we make them second nature. And I'm saying this to you right now, that it will be difficult. It's not going to be easy. I tried to use all these systems that are being set up on campus myself, to go get food wearing a mask and to eat food sitting 3 feet away from the person that I was having lunch with. It is very difficult. It requires a lot of change. I couldn't even, to some extent, although I'd taken off my mask, I couldn't even taste my food, because you are used to eating in a certain way and talking in a certain way. So it's going to be difficult. But the future of whether the future trajectory is towards positive depends upon us. So if we find that our systems are stable, our systems are responsive to the students' needs, we will continue to tweak them, we will continue to change them, we will look forward to feedback from you. We will take into consideration the mistakes that you make, the mistakes that we make. But if eventually we are able to come to a steady state where we feel that we can manage this number of students, then the university, I'm sure, will make a decision to open going forward. You know, the long-term trajectory of what happens next semester and what happens next year, I'm sure Dr. Ali Khan can speak to that.
Yeah, it's a big question to ask. I think everyone is wondering what is going to happen in the future. It's very difficult to answer it. I think, like I mentioned at the start, I think COVID is a disease that we're still learning so much about. We don't know what the long-term impacts of having it are. I think we just have to take every day as it comes. We have to strengthen our systems so that we can learn to live with this, because that is a possibility. And that will require a change in our behavior and the way that we live. But, you know, at the moment, you know, some people have brought up what is going to happen in spring. You know, we don't even know what's going to happen a month from today. You know, I remember reading that sometime in June, France had 0 cases, and yesterday it recorded 7,000 cases. So they had felt that they were over the disease altogether, and it has come back in a very strong form again. We are going to go into a winter season where the air is much drier, where the pollution is much higher as well. Now, how that affects respiratory, you know, illnesses, we all know. Whether it'll cause COVID to become a bigger factor is something that we're going to have to wait and see. But in the meantime, I think we have to take certain measures. We have to make sure that we are following the SOPs in order to ensure that, you know, if there is any kind of further spike, that it is kept as low as possible so that, you know, life continues, you know, as normally as it possibly can. But, you know, I think it would be irresponsible for us to say that, okay, well, you know, 3 months from now or 6 months from now, everything will be fine, because I don't think there's a person in the world who can make that call.
Yes. So I know that, Ali, you have sort of responded to it in the chat, the Q&A already, but this question keeps coming back about HEC's decision. So people are saying, if HEC has said it, then how can you violate that? That if they are saying you have to open on the 15th, and if it's safe for them, why would it not be safe for LUMS? So if you want to say something.
Yeah. I'll mention, actually, because we were in a meeting with the HEC, I think a week or so ago, and this is not true that the government has ordered all universities to be opened. That is certainly not the case. In that meeting, what was made very clear is that every university has autonomy and can open or not open according to its capacity and you know, the level of preparedness that we are at. So you know, it's wrong to say that the government will say 15th September open and every university will open, because I think that it's not really happening in the majority of universities. So I think we can only be guided by what we feel is the responsible way forward. You know, I understand that people think that this is a cautious approach, a conservative approach. You know, still, I think safety trumps everything else. So LUMS will continue as per the guidelines put out by the government to open as we feel our systems prepare for that opening.
Okay, Dr. Samia, you want to add anything to that, or?
No, I think Ali has covered all that. Yeah. Because let me take the opportunity. Ali has covered it, but let me reiterate again that you know, whatever directive comes from HEC or organizations like that, ultimately the responsibility and liability rests with LUMS. So the university, like Ali said, the university has to make a decision that since they are responsible, that their decision should be based on their own assessment of how to keep their students safe. Not follow AGC's directive. So yeah.
Yes. So because there are, I think there are a couple of questions about other universities, IBA, for example, opening. And so I think, again, there is this sense that perhaps LUMS is being too cautious. I think that's maybe, and again, all I can say at this point is that it's starting carefully with very sort of step-by-step process is more responsible at this point, because I think one of the things that maybe you should appreciate is that in some ways it's easier for us to just go ahead and open the campus because it's in the university's interest. We all are eager to come back. It would be simple enough. But again, and this has happened, by the way, in many places in the United States, for example, you open up the university the first week or 2 weeks, and then you have a cluster of cases, and then you are forced to go right back online or something. So I think the process that LUMS is adapting in terms of opening slowly, cautiously with all these plans that we have, formulated. And again, the details of it you will get with the document that we'll be posting online. So we think our approach is more responsible and ethical. Yes, different universities are taking different making different choices at this point, but I think that we are trying our best to make under very difficult circumstances, a more considered approach to this whole situation. And I don't think any of us really want to be where we are, but it's really, that's the card that have been dealt to us. Okay, so let me see, because lots of these are really questions about, again, the learning online. And Ali, you might be able to comment on this. A couple of times questions raised about labs and how do we get access to lab, and what about the university, library resources, etc. Is there anything you would want to say about that?
Well, as you know, the people who require labs for the School of Engineering, Science and Engineering are a group that we're looking at in terms of bringing on campus earlier than others because they need it in order to complete their degrees. So that is something that we are actively discussing at the moment. Library resources, again, I think that we'll have SOPs in place for the library. There is a possibility that, the whole catalog, of course, is online. And if you wanted a particular book, you can order that book and the book can be made available for you to pick up. So, these are as they open up, we need to find ways in which they can be opened up safely, in the same way that when the canteen opens up, we'll have takeaway and maybe, lesser sitting areas, but, it will be open. So, all of these are efforts that are being made. I will say about, because there are questions about connectivity and, what happens with CP, etc. And as Dr. Farhat mentioned, there's been a lot of conversation about this. And the long and short of it is that, all the faculty are well aware of the fact that a lot of people have unstable connections. A lot of people are suffering from that. In some areas, you have no connectivity. And again, that's a priority group that we're looking and discussing about bringing back on campus. But otherwise, faculty are aware of this. Your CP will not be affected. There will be multiple ways in which you can do CP. That can be, afterwards in a forum. It can be over the phone if need be. It can be a written email. So all of these things are being taken into account. We're also taking into account that we don't want too much time to be spent online because of the possibility of you losing a connection, for example. So there'll be some online, there'll be some offline, there'll be synchronous and asynchronous. So this is a new area that we're going, and I think that we are prepared for it. I know it's causing a lot of stress and anxiety, but we are aware of the fact that you are in this position, and all of the faculty are aware of it and will make compensations for this position that we find ourselves in. So I would try not to worry overly about this at all.
Thank you very much, Ali, for that. So another question is, Dr. Samia, what about the vaccine? Let's say vaccine comes to the market soon. How does that change the picture in terms of particularly opening and, yeah.
Yeah, the vaccine situation needs to be taken, understood in this context, that number one, the many vaccines are being tried and they have gone to population testing stage. So there is not even, there are hopeful signs, but there is no confirmation that some vaccine is going to work. The context in which, and the other issue is the Pakistan having access to that vaccine. Pakistan's experience of, and the country's experience of having vaccines come into the country and vaccines being distributed. You have in front of you the experience of vaccine for measles or vaccines for polio being distributed, which comes in for free. And this vaccine is not going to come in for free. The access issue is a very, very critical issue. You know that this vaccine has been funded, the research has been funded by US government, by German government of Germany. So whoever funds the vaccine trials and vaccine development has first access to that vaccine. When will you have access? How will it be transported? How will it be distributed? What is the distributing mechanism going to be in your country? Even if Bill Gates says that, okay, I will buy it for Pakistan and send it for Pakistan. So in my own calculation and my own calculus of what's going to happen in the future, for the next 4 or 5 years, I think Pakistan should forget about getting a vaccine and having access to a vaccine. We have true and tried methods at our disposal. Students who are students of history will find many gaps in what I'm going to say. That in 1800 and something, when Florence Nightingale went as a nurse to care for soldiers who were in the Crimean War, the hospital was full of doctors and full of infectious disease experts. But she was able to bring down infection rates by opening windows and by making doctors and other people wash their own hands and wash the sheets and bedding of soldiers. So these are tried and true tested methods that decrease infections in people, that decrease the spread of infection. We have those at our disposal. So vaccine is fine. We should keep that in our back pocket. And if the opportunity arises, yes, we should stand in line to say that we have vulnerable people who need to be vaccinated. But if we are going to hang all our eggs in that basket, then it's not a good strategy.
Okay, thank you. So another question is about implementation mechanism. How would we ensure that that everyone is following SOPs, or in other words, what would be the consequences if people did not follow those safety protocols?
That's me. I will take the first part, and Ali, you, I request you take the second part. To ensure how the SOPs are followed is quite easy. And having said that, let me also say it's quite difficult, because the onus is completely on me, on the individual. And I say it is difficult because I have to learn to change my behavior. We have learned to conduct ourselves during the day in different activities in a certain fashion. And when we are young, when we are 18 and 19 and 20 years old, we know, we think ourselves invincible. You know, young people, research shows all over the world, are impulsive, they take risks, they feel themselves much more secure and stronger than they actually are. So yes, you will take chances, you will say that, you know, it doesn't matter, but let me not do this. Kya farak padta hai? Those things will happen. But I'm saying the success of the SOPs, we have developed very meticulous SOPs that are related to most of the daily activities that human beings normally conduct, you know, living and laundry and food and washing, and related to most of the activities that you as students will conduct on campus. For example, how to access the library, how to use labs, how to use the gym, how to use the canteens, how to meet each other, how to have party on campus if you want to have. So we have developed meticulous SOPs for all of that, because we understand that we want to make, even in this restricted and very constrained environment, we want to make this a fun experience, a useful experience, and an enjoyable experience for you. But the ensuring of how this is complied, the compliance depends upon two factors. We understand, and we will have monitors who will nudge you to say and remind you, which includes me also. I also at times need to be reminded that my mask should not be around my chin and it should be on my nose and mouth. So we will have monitors, we will remind each other. But the onus is on you, the individual. You have to tell yourself every day that I must, whenever you step out of your room, you have to have a checklist of your own, that I have my mask on my face, I have washed my hands, I have my sanitizer. When I leave my room, I will clean my doorknob. You know, you need to get into that kind of ritual, and you will ensure that you know, you are following SOPs. Over to you, Ali.
Yes. So what would happen if you didn't follow the SOPs? I think the answer to that is really, you have to think about the fact that an individual who doesn't follow the SOPs is putting themselves at risk, maybe less so because of your age, but you will put at risk the cleaners who are there and have to clean. You will put at risk the people who work in the canteen who are providing food. You will put at risk the guards. You will put at risk the hostel wardens. All of these people have to come back if there's going to be some presence on campus. You will also put at risk that one individual who is not following will put at risk every other student who is on campus, because if there is an outbreak, then we will shut down. In fact, we won't have a choice, because more than a few cases, you have to report it to the government, and the government will institute a smart lockdown. So you will be responsible for ensuring that LUMS will not open for a much longer period if you do not follow the SOPs. So the responsibility is on the individual to ensure that the community stays open and safe.
Okay, thank you very much. And so I think there are, in terms of this health and safety on campus, I think we have addressed most of those questions. I'm hoping almost all of those questions. The rest of the questions, as I said, have to do with the issues of online learning, and that we have a panel about that later on. A few of you have raised this whole question about tuition fee, and why is it that we have to pay the same amount for online classes. So let me first just say that this semester, at least, there was no fee hikes. I'm a new person, so I'm still trying to, and Ali will correct me if I make any factual mistake. But it's my understanding that there was no fee hike, which is a major decision in Pakistan, given how everything else increases. There's a inflationary pressure on everything else, all our expenses. But the other thing is, look, the most important thing in LUMS is our teaching you guys, teaching students, and so our faculty, we have an excellent faculty, and they work very hard to deliver the best education that they can to you. And, they're prepared to teach you online, and they prefer to teach you in person. And so in terms of the quality of education, we are not cutting any corners. We have the same expenses, we have the same, quality it's just that because of circumstances, again, beyond all of our controls, we have to go online for now. And so I think that this whole idea that somehow, online learning means cheaper learning is not necessarily a sound kind of a conclusion to come to. Ali, is there anything you would want to add to that, or?
No, I think you've covered it.
ठीक है. All right, so I think we have the last 3-4 minutes. Let's see, I think we have, as I said, addressed most of these questions, and I see that there is, in fact, just now, from Punjab Education Ministry, there had been a tweet that all public and private schools in Punjab will be opening in the following schedule. So it's the September 15th. I think that's what some of our participants were referring to too. And as we said, that's what we are planning to open our classes as per government directive on 15th. But for now, it's going to be online. But again, we hope very much if we follow these SOPs, and if, hopefully, as we keep bringing more people, more students on campus. There were a couple of questions about our categories of students that we are bringing to campus. I think, the biggest, of course, category is those who have connectivity issues, and it has not been an easy process. We understand that there are more people who would prefer to come to campus, and this is the first batch. And if things go well with the first batch, then slowly, that is what we're planning to do, is to slowly bring more people in. Several of you have sort of said, how can I get used to this, university life behind screens and not having the ability to have in-person orientation week, etc. I absolutely understand that. In some ways, your class of 2020 that is just starting their university career is dealt a bad hand, as all of you and all of us have been in some ways dealt a bad hand in 2020. But I think, at LUMS, they have worked very hard to try to make sure that the orientation week online is as informative and as full of fun as it could possibly be. Obviously, it cannot completely replace the in-person experience, but listen, sooner or later, you will be on campus. We will see you there, and we will make sure that you have the opportunity to make up with some of the fun that you have not been able to do because it is, orientation week is online. So, we're all optimistic. This is a short-term problem, and we hope that soon we could all be on campus and resume our, normal activities. But meanwhile, please make the best of this opportunity. There's even in world wars, there are ways that people kind of survive and learn lessons and become stronger. And as Dr. Samia was saying, you will look back and you will tell stories about this time to your grandkids. But meanwhile, we as an institution are trying our best to be very sensitive to the stresses that you're facing and trying to respond to those. So I think with that, this session is concluded. I know you're going to have other activities. And again, I am very much looking forward to seeing you in person. Dr. Samia and Dr. Ali, do you want to say any parting words? Say, you know. No? Fine?
No, thank you. Yeah,
okay.
Thank you very
All right.
much.
Okay, so we'll conclude then this session. Okay.
Thank you.
Thank you. Take care, everyone.